Welcome back to FAMWISE. In this lesson, we're talking all about cycle syncing and what that is. Let's get into it. So cycle syncing is the act of incorporating certain lifestyle actions into your day depending on which phase of the cycle you are in. And this in turn can help support each phase and the proper fluctuations of hormones, leading to better balance. So, if you know what to expect with these different phases, this allows you to better give yourself the grace when you don't feel the same every single day. And it allows to let your partner know as well and let them know that you might need extra support at certain times in the cycle. So, some areas we look into when we're discussing cycle syncing is self care, mental health, intimacy, diet, and exercise. And depending on the certain fluctuations of your hormones, like the chart below, this will affect those different aspects. So, when estrogen is high, like that blue line, you could feel more confident, more outgoing, and more social. And when your progesterone is high after ovulation, like that gray line, you can feel more relaxed, a bit less social, and more of a homebody. So, looking deeper into each phase, sometimes we explain this as seasons. So, your menstrual phase is like your inner winter. This is where your hormones are low and we like to rest and reflect. Your follicular phase is your inner spring from days approximately 7 to 14. So this goes from the first day of your period up until ovulation. And this is more of your building phase. So your inner spring, everything is blooming. You have your ovulatory phase, which is your inner summer from about day 9 to 14. And this will be your growth phase. And then we have your luteal phase, which is your inner fall, which is like your maintenance phase. And that's from day approximately 15 to 28 or after ovulation until your next period. So you can see on the chart below, you have your menstrual phase there, the follicular phase until ovulation, your ovulatory phase during that fertile window there with the mucus, and then after once we're in our luteal phase, and then after ovulation, we have our luteal phase. And remember that there's a fine line of having too many symptoms and having this be normal and balanced. It is normal to not feel the same every single day, and for things like we mentioned earlier to fluctuate, but it should never be so bad that this is interfering with your daily life. So, if that's the case for you, I would look into this further. So, your menstrual phase is your inner winter, and here your hormones are at their lowest. So, it lasts about 3 to 7 days from day one of your period, and your basal body temperature has dropped here, and your cervix is generally low and firm and slightly open to allow menstrual blood to pass through. You might experience some bloating, lower back pain, headaches, migraines, food cravings, fatigue, low energy, feeling relieved, self reflective, introverted, and your intimacy may be lower or higher. So during this phase, we want to rest, reflect, and recharge. You might feel fatigued due to these low hormones, and you're also shedding a uterine lining that you've built up approximately over 30 days, so it is normal to feel a bit tired. This is the best time to listen to your intuition or journal, and research shows that the two halves of the brain are most active during this time here. So think about what are the things you're tolerating, what are the things that are draining your energy. These can become very clear here. So it's great to ask yourself those questions like, how am I feeling about my life? Can I talk to my partner? Do I feel supported? So I urge you on your next period to give that a try. During your period, you can lose quite a bit of blood, so that means you are losing some iron. And symptoms of iron deficiency are continuous feelings of low energy, low moods, menstrual headaches and migraines, lethargy, breathlessness, heavy periods, spoon shaped or brittle nails, very pale skin, hair loss, or white marks on your nail beds. And if you're having very heavy periods, that can be a sign that you have low iron as well. So I would suggest getting your iron or ferritin levels checked through blood work. So that's why during our menstrual phase, we should be including lots of iron-rich foods like grass-fed beef, organ meats, lamb, dark poultry, beans, lentils, quinoa, and kale. And iron is best absorbed when paired with vitamin C-rich foods, and it also works together with vitamin A and copper to be properly utilized in the body and help build red blood cells. So focusing on those foods to help replenish iron stores can be really helpful. What you don't want to do is supplement iron if you don't need it, because this can be very harmful and inflammatory for your body. And usually I see food-based incorporation boost levels better than supplements, because usually there's a nutritional deficiency or a gut health problem, which is blocking absorption. So again, back to those organ meats, liver can be very helpful for this as well. So therefore, you can also incorporate lots of vitamin C-rich foods like citrus, kiwi, berries, peppers, and broccoli. You can include copper foods like liver, oysters, potatoes, mushrooms, cashews, crab, sunflower seeds, or dark chocolate. And then vitamin A foods, like again, those organ meats, cod liver oil, or dairy. Magnesium is a very important mineral for overall health. It's involved in over 300 reactions within the body to help it function normally. And these days, our soil is more depleted from heavy farming, and therefore there's less magnesium in our food. And chronic stress can also further deplete magnesium. And this becomes a vicious cycle because magnesium helps to calm the nervous system. Signs of low magnesium are eye twitching, fatigue, low mood, muscle weakness, cramps, chocolate cravings, headaches, feeling stressed, and having high blood pressure. Magnesium can also help to ease period cramps and moodiness, and can also help with sleep quality and stress. So, because of this, I would consider a supplement. Usually, the dose is about 100 to 300 milligrams. And there are different types of magnesium. So, magnesium bisglycinate or glycinate can be really relaxing, a good one to take before bed. It's really well absorbed. Magnesium citrate is a great one if you struggle with constipation, because that one draws a bit more water to your bowels, so that can help you go. Magnesium L-threonate is a great one if you get headaches, because this one can cross the blood-brain barrier. And magnesium malate is another well-absorbed form that you should take during the daytime because it could help to boost energy a little bit as well. And then, of course, you can use a magnesium spray as well, which people like to rub on their feet or spray on the inside of their calves, especially if you have muscle aches. B12 is important to focus on because that helps our body make red blood cells and a healthy nervous system. And vegans and vegetarians need to be extra careful about this because they probably aren't getting enough. And usually this does require a supplement. And when choosing supplements, opt for a methylated B12. This will be absorbed better. And if you have any methylation issues, you can use hydroxycobalamin or adenylcobalamin, which I've included that information in the supplement cheat sheet. Omega-3, which we've discussed before, is anti-inflammatory, and we can't make this ourselves, so we have to get it from foods like seafood and algae. And this can be helpful to support your mood, your brain health, period pain, and acne. And if you struggle with heavy periods, make sure you're getting enough vitamin K from spinach, kale, and broccoli. That would be K1 to help with blood coagulation. And then K2 can help direct calcium towards our bones where we want it instead of towards our arteries. So that's especially important if you are supplementing vitamin D. You want to make sure you have enough K2 along with that. So include things in your diet like natto, grass-fed cheeses, and beef and chicken. Chinese medicine likes to suggest lots of warming food during this time to help soothe cramps and have proper menstrual flow. So you can also consider doing that as well, lots of soups and stews. During the menstrual phase, this is where your energy levels are likely going to be their lowest due to that low estrogen at this time. And I feel that we've been conditioned to feel that we have to push through and work out every single day in order to be healthy. But the reality is that doing so can actually put extra unnecessary stress on our bodies, making this counterproductive. So if you're an athlete or you can't avoid doing harder workouts on or around your period, be sure that you're taking additional rest and eating enough nourishing foods like the ones we covered. So lower impact exercises, especially in the first few days, can be really helpful. This includes walking, swimming, yoga, stretching, or breath work. You want to go slow and listen to your body. And low estrogen at this time can increase your risk of soft tissue injury. If you feel that you have the energy to work out during your period and you need to expel more energy and go a bit harder, by all means, you can do that. You don't have to limit yourself. This is just like a general suggestion. But do listen to your body, because if you push yourself harder here, it can take longer to kind of recuperate after your period. And that could lead to lower energy levels throughout the rest of your cycle. So here is just a menstrual phase overview. So you have days 1 to day 7 during your period. The hormones at play here are estrogen and progesterone because they drop significantly. Some may notice a reduced focus and cognitive performance, but you might have enhanced intuition and creative thinking. You might crave more iron-rich foods or comfort foods or warming foods. You might crave more iron-rich, comfort, or warming foods. At this time, you are shedding that uterine lining, so you might feel fatigue, potential cramping, and reduced energy levels. You might feel an increased need for rest and emotional support. You might feel moody or have a flat mood due to these hormonal shifts. And then libido can be low or have a sudden rise. And then for movement, we want to focus on gentle exercises like stretching, walking, and light yoga. The follicular phase is your inner spring. So now your period is over, those hormones are starting to rise, and you likely are starting to feel more like yourself. This is due to that FSH acting on those follicles, which are growing and producing more estrogen. And then also testosterone is starting to rise as well in the late follicular phase. And this will be about day 1 to 14 is your full follicular phase, but you could feel this from like after your period, maybe day 5, as we head into your ovulatory phase. And estrogen is the star of this phase, and it helps give us that energy boost, glowy skin and hair, as it's linked to increased collagen production and more hydrated skin. It can also help aid wound healing. So if you're prone to acne, you might notice a bit clearer skin here as well. And if you find you break out around ovulation, it could be linked to your estrogen levels. And when our hormones are rising, they have a positive effect on our mental health, as estrogen can help support serotonin and dopamine production as well. So you might feel more resilient, feeling more like yourself, better mental health, increased energy, clearer, more glowy skin, confidence, feeling stronger, more extroverted and social. You might feel like you want to take more risks, have more creativity, and this is a great time to plan events for. Here, your temperature is still low, your uterine lining is thickening, and your cervix is low and firm. And then as we approach ovulation, we can see that increasing cervical mucus. Foods we want to incorporate here are antioxidant-rich foods. So these help to fight damage from free radicals in the body, and they can help to lower inflammation and support immunity. Our body wants us to feel safe and healthy as possible heading into ovulation. So this can help support regular ovulation. And that will be foods like vitamin C rich foods, vitamin E, and selenium. Selenium is a mineral and antioxidant that helps support ovulation, but also your thyroid health. It can help to lower thyroid antibodies and support production of those thyroid hormones. We need about 55 micrograms of selenium per day, which you can obtain by eating a whole food diet, including 1 to 2 Brazil nuts per day. Zinc is a powerful anti-inflammatory and important building block for hormones. It helps the brain release FSH to support the maturation of the egg and regular ovulation. It can also support progesterone production in the luteal phase. So zinc can be used in supplement form a few days before your period starts. If you get really bad period cramps, that can help that as well. And usually that's prescribed at a dose of 30 milligrams. So ask your doctor about that one if you have period cramps. But other than that, you can focus on grass-fed meats, oysters, mussels, clams, and pumpkin seeds. Choline is one we have touched on, and it can help support egg quality. Fiber is really important to include to help stabilize our blood sugar and go to the bathroom regularly. So that would be lots of leafy greens, cruciferous veggies, nuts and seeds, vegetables and fruit with the peel, carrot, sweet potato, oats, quinoa, and brown rice. Phytoestrogens can help bring estrogen back into balance by either bringing estrogen up or bringing it down. There is some controversial views around phytoestrogen foods like flaxseed, miso, and soy products. So do whatever is best for your body. And then focus on healthy fats like avocado, animal fat, coconut, and olive oil. Because remember, our bodies do need a certain amount of fat in order to ovulate, and that has to do with your hypothalamus being happy. If your hypothalamus is happy and it feels safe, ovulation is more likely to occur. And then focus on those omega-3 foods like fish. So your energy is rising during that follicular phase, so you can try some higher impact workouts, try new things. You might have more motivation to go to the gym and work out. You can include walking, swimming, yoga, stretching, along with your HIIT exercises, strength training, Pilates, and running. And although your energy is rising, still listen to your body and don't push your limits every single day, because sustained high-intensity exercise or long runs can have a negative effect on your ovulation and can lead to longer menstrual cycles, and in some extreme cases, hypothalamic amenorrhea. So that's where your period goes missing for months at a time, and this is due to stress and low energy reserves and calorie intake. So be sure you're properly nourishing your body and getting enough rest. Again, your cycle is going to tell you if this is occurring. If you are going months and months without a period, I would do a blood test to check for your FSH levels and your LH levels, along with your estrogen, and that can better help determine why your period is missing. So your follicular phase overview, we have day 1 to ovulation, but likely you'll start to notice this rise as you get out of your period up until ovulation. The hormones at play here are estrogen and FSH and LH, which are rising gradually. You might have increased focus and detail-oriented thinking and higher cognitive performance and verbal skills. Your appetite does tend to be a bit lower here due to estrogen and stabilizing blood sugar levels, and you might have increased cravings for nutrient-dense and fresh foods. Your uterine lining is building up, you have increased energy and endurance, and your skin often appears more clear and glowy. You'll likely see improved mood and optimism, and higher motivation and self-esteem. Your libido starts to rise slightly as ovulation approaches, which increases interest in social connections. And during this phase, you'll start to focus on strength training and higher intensity exercise. Ovulation is your inner summer, and here your body is maximizing fertility to get our bodies what it wants, and what it wants is to get pregnant, even though we might not want to get pregnant. This lasts from about day 9 to day 14, wherever your fertile window is for you. Here, your uterine lining is thickening, you have increased cervical mucus, that EL and ES. You'll see that temperature, which starts low, and then you can see that sudden increase after ovulation, and your cervix shifts to a high and soft position. Likely here, you'll feel your best, have better mental health, increase energy, clear glowy skin, be more more confident, feeling stronger and more extroverted. You may take more risks or feel more creative and have a higher libido. So your ovulation only occurs on one day, but you do have that fertile window, and likely the 5 or so days before that, you'll start to feel these different things. You might experience Mittelschmerz, which is that slight pain on either side wherever your ovary releases the egg. Some people get a little twinge of pain, a sharp pain, or like a cramp, and this can feel a bit different depending on the person and their inflammatory levels. If your pain is more severe or it lasts longer, this can be a sign of too high inflammation, pelvic scar tissue, endometriosis, adenomyosis, or pelvic inflammatory disease, and warrants further investigation. Foods to include during your ovulatory phase are vitamin E rich. This can help support progesterone production in your next phase, which is that luteal phase, and can help support proper blood flow to the uterus. Vitamin B6 can help balance estrogen and progesterone. It is essential for our body to make the corpus luteum, which will be making that progesterone, and also support proper detoxification and neurotransmitter production, therefore supporting your mood. Vitamin B6 can also help support the breakdown of histamine, which can be linked to worsen PMS symptoms, and histamine is also directly linked to your estrogen. So around ovulation, if you feel a bit worse, it could be linked to that histamine, because these high estrogen levels at this time can worsen histamine intolerance, and histamine can boost levels of estrogen, so it just becomes this repetitive cycle. Vitamin D is the sunshine vitamin, but if you live somewhere where you're not getting sun for half the year, I do recommend testing your levels and then supplementing accordingly. Vitamin D deficiency affects around 50% of the global population, especially those with darker skin, and this is important because it helps our bones stay strong, our immune system to stay strong, and is hugely important on hormonal and menstrual health function. Low vitamin D has been linked to fibroids, PCOS, and ovulation, and period pain, so I urge you to check your levels. Getting approximately 10 to 20 minutes of sun per day in the off-peak hours outside of 12 p.m. to 3 p.m. You can also include things like wild salmon, mushrooms that have been by a window because that helps to make vitamin D2, fish, whole dairy, and eggs. Probiotics is another one to consider, which can help support the gut and keep you regular along with fiber. Each strain has a different effect on your health, so eating a variety of different fruits and vegetables is the best way to diversify your gut. But some of these strains are specifically important for balancing estrogen levels and detoxification, and that is called your estrobolome. During your ovulatory phase, likely your energy is at its peak, and this is because estrogen promotes glucose availability and uptake into the cells to use as energy, which makes higher intense short HIIT exercises a great choice right now. So you can do your walking, swimming, yoga, and stretching, and then you can also focus on HIIT exercises, strength training, Pilates, and running. And of course, as always, be sure to listen to your body. So for an ovulatory overview, this will be around the middle of your cycle. The hormones at play here are peak estrogen and LH, and a small spike in testosterone. You may notice heightened social and verbal skills and increased confidence and decisiveness. You might see a slight appetite suppression or cravings for light and fresh foods. Your cervical mucus here becomes clear and stretchy. We can see that EL and ES mucus. Your body temperature will rise slightly after ovulation, and skin often glows and appears more attractive. You might have increased energy and sociability, greater creative and problem-solving skills, and will likely see that peak libido and attractiveness to your partner, along with increased flirtatious and desire for connection. And for exercise, likely you'll be able to handle more, you'll have your best workouts here, and can go more intense. And last but not least, your luteal phase is the fourth phase, and this is your inner fall. So here progesterone is dominant, and your hormones drop at the end of the cycle. Generally, this is from day 15 to day 30-ish, or the day after ovulation until your next period. And in our early luteal phase days, we will still be on a high from after ovulation, but as we continue, we're more prone to PMS symptoms and more of these luteal phase experiences. So progesterone also helps to nourish your uterine lining. Your cervical mucus dries up, so you'll see more of those G days, but we can see some EL or ES mucus kind of in the middle or right before your period, as that estrogen can increase a little bit, or when your progesterone drops off at the end of the cycle. Your temperature will be higher here as well, and your cervix will shift back to a low and hard position. So here you could get those PMS symptoms, PMDD, your inner critic might come out more, you might be a bit more moody, anxious, or irritable. You could have lower energy, be a bit more introverted, and experience less motivation or breakouts. And remember that the luteal phase doesn't have to be a bad phase. This can be just more of a lower energy, turning inward. Diet, lifestyle, and supplements can do a lot to help support this phase, phase and our cycle to make a more smooth transition. It can just be a phase where we slow down, feel a bit more flat with our mood, and tend to eat a bit more due to the extra demands for energy. During the early luteal phase, due to the increase in estrogen and progesterone, our ability to break down fat and protein increases, which can result in an increase in appetite along with that metabolic shift. Here we can see lower blood sugar control as well, so you might have a bit more cravings. So please eat mindfully, and if you feel like you need more food, by all means eat more and keep a balance of proteins, healthy fats, and fiber. The luteal phase usually lasts approximately 9 to 16 days, on average about 12 to 14, and too little progesterone can cause your period to come sooner and can increase PMS symptoms and spotting before your period, and this is due to that early breakdown of the corpus luteum. Another frequent cause of PMS is higher estrogen, which can bring on those many symptoms because progesterone helps to negate and balance the effects of estrogen. So if progesterone is low in relation to estrogen or estrogen is too high, then we can run into problems. And this is where lifestyle and diet is so important because it can help to balance these hormones. So foods to incorporate during your luteal phase, again, we have magnesium, which can help stress response and anxiety. B6 can be really important for mood regulation and detoxability. So if you get any anxiousness or depressive thoughts, moodiness, and irritability, that can really help that. Vitamin B2 is also required to convert B6 to its usable form unless you're taking a pre-converted B6 like vitamin B6 P5P. You can also focus on wild salmon, skipjack tuna, chicken, sweet potatoes, avocado, and banana. Tryptophan is a key player in production of serotonin, which helps support mood at this time. You can do wild salmon, turkey, mushrooms, fish, whole dairy, and eggs. Calcium can really help to support PMS. Potassium works together with sodium to maintain electrolyte and fluid balance within the body, and it can help with progesterone and helping reduce bloating. Sodium is really important for hydration and allowing water to enter the cells, and iodine can help with cyclical breast tenderness and proper thyroid function, so you want to aim to obtain iodine from food. But if you reach for a supplement form, just make sure you're checking your thyroid levels before, especially if you have a pre-existing thyroid condition like hyper or hypothyroid. And signs of an underactive thyroid can be heavy periods, fatigue, hair loss, cold hands and feet, and the outer portion of your eyebrows thinning. During this phase, we can see an increase in calorie demand. So some say about 300 calories, and this will differ per person. That's due to blood sugar control declines and insulin sensitivity, along with that boost in your metabolism. Again, you might get those cravings during this luteal phase, and what you crave could actually mean that maybe you're slightly low in certain nutrients or minerals. So if you crave chocolate, it could mean that you have a need for magnesium or tryptophan. If you crave sweets or candy, this could be low or wonky blood sugar or too high cortisol. So therefore, increase your protein, healthy fats, and fiber at each meal, and you can include more magnesium, chromium, and potassium. If you crave salt, this might mean you're under chronic stress, you have excessive sweating, and you need to replace this with more sodium. And if you crave simple carbs, this might be because of your mood, as this can temporarily increase serotonin and help to support mood and energy levels. So make sure you're getting enough carbs. This will help you feel more satisfied, but you're being sure to pair them with proper protein and healthy fats and fiber. During the luteal phase, your energy is declining here, so embrace that change and accept that you might not be able to work out as hard as the follicular phase or your ovulatory phase. So focus on lighter strength training, body weight exercises, walking, swimming, yoga, stretching, and breath work. And of course, listen to your body. During that early luteal phase, you still might be on a high from ovulations. You can continue to do higher energy demanding workouts, but as you progress into the late luteal phase, you'll likely see that decline in energy. So here is your luteal phase overview. This is from post-ovulation till the day before your period. The hormones at play here are progesterone, which dominates. Then we have a bit of estrogen and testosterone, which drop gradually. You might see an enhanced ability to focus on detail-oriented or repetitive tasks, and you might have more introspective or reflective thinking. Your appetite may increase due to these higher progesterone levels and cravings for comfort food or high-carb snacks due to the lower blood sugar control. Your body temperature remains elevated during this phase, and you might see bloating, water retention, and breast tenderness. You might feel more calm and patience during this early luteal phase, and you might see irritability, mood swings, or anxiety closer to menstruation. Your libido can drop during this time, but this will vary by individual, and your desire for more emotional intimacy and connection can increase here. And for exercise, focusing on moderate or lower intensity exercise. So a quick recap of all the different phases of our cycle. We have our menstrual phase, which is our rest and reflect. Our follicular phase is our building phase, and then we have our ovulatory phase, which is for growth, and our luteal phase is maintenance. So remember that it's normal not to feel the same way every single day, and these tools are for you to use, but you don't have to stick with this. Take what you like and really leave what you don't. I want you to work with your body depending on where you are and what place you're in. Everybody's body and cycle is a little bit different, so pay attention to how you feel and what will work for you. Write down on your charts about what you are doing, so you can see if it has any effect on your chart or what things you're most likely to experience depending on these hormone shifts. So these aren't rules, you don't have to follow them, but they are a supportive tool which you can use to help support your cycles. So that's it for this lesson, all about cycle syncing. You can consider using those in your day-to-day, and I will see you guys in the last lesson about who's on your team.